do you like my jacket? It's yellow. Today, we are going to be talking about Juvederm Volite. Now, these products, Juvederm Volite, Restylane Vital, Profhilo, yada yada, TSR Redensity 1, these injectable moisturiser products, I find them quite interesting. And I find the concept of them quite interesting. So, you know, with a normal filler, you'll use it to revolumize an area like lips, chin, cheeks, temples, whatever. But with these products, you inject them superficially in the skin in order to stimulate collagen and cellular turnover. So they're really completely different, or used in a completely different way to a traditional filler. And for me, that's quite interesting because patients will either, you know, maybe they don't want to have a traditional filler, but they're happy to have Volite, they're happy to have Profhilo, that's all okay, but they don't want to have Volumo, no. They don't want to have, I don't know, Volux, definitely not, because that will change the structure of the face, you know, hopefully for the better. But something which is good for your skin, hey, that's fine. Who wouldn't want that? So I just find it really interesting because the only difference between the Juvederm Volux and the Volite is the amount of hyaluronic acid in the syringe. So the Volite has 12 milligrams per mil. The Volux has 25 milligrams per mil. So of course it's more than double, but the Volite's still cross-linked. Some of the other products which are used in a similar way, for example, Restylane Vital, Restylane Vital Light, that's also cross-linked as well. But then you'll have others like the Redensity 1, which are not cross-linked. What difference does that really make? Well, because it's cross-linked, it hangs around in the skin a bit longer. So that means that when you do the treatment, there better not be any lumps and bumps in the skin afterwards because they're going to stay there. Whereas if you do that with Redensity 1, it doesn't make any difference because it will go. In terms of how it's injected, with the Volite, you have to do multiple very tiny, small injections very superficially in the skin. It's quite different to doing Profhilo, for example. I'd say the technique was much more similar to using Restylane Vital, except with the Volite, you only need to do one session every 6 months. If the skin's very poor, then you'll probably need to do more than that, but for maintenance, once every 6 months is fine. One syringe of Volite will treat an area roughly the size of the palm of the hand. So if you need to do the full face, you really need to use 3 mils. Here, here, and here. If you're treating the neck, 1 or 2, depending on the severity of the skin quality. And if you're doing the chest, again, it really depends. If somebody has got multiple lines already in the skin, then maybe you need 2. But if you're just doing it for prevention, then 1 is probably okay. The Volite also contains 0.3% lidocaine, so afterwards the procedure's not uncomfortable. But you know, you still need to have multiple small injection points done. So you might want to have a topical anesthetic before you have this treatment done. You can use this literally anywhere on the body. Maybe not in the A-frame, but pretty much everywhere else. So you can treat the arms, elbows, knees, inner thighs, but wherever you want to see some skin improvement, you can use this. Because of the cost though, I would say that most places would be the face, neck, chest. Actually, sometimes hands. If I'm going to do hands, I'll do 1 syringe per hand. It works very well for that. Patients often ask, which one should I use, Profhilo or Volite? Well, if you want to treat around the mouth, really the Profhilo is not going to do too much there. There's a very set injection pattern that you follow with Profhilo of 5 injection points on each side of the face. With the Volite, you can use it, for example, in the vertical lip lines. You can even just use it in the body of the lip if you want to improve the skin there, but you don't want to have a proper lip filler done. And this is one of the most common areas that I inject the Volite in, is the lip area and the vertical lines. Some people would use it around the eye. It's not my preferred product for use there. I prefer using the Redensity 1 and 2. For the lip indication that I just mentioned, some people would use maybe Restylane Vital instead. I know Kish certainly loves his Restylane Vital in that area. I prefer using the Volite. I would say if you're going to use it to treat the whole face, it's my opinion that you get a improved luminescence with the Volite over, for example, Profhilo, but you don't get the lifting effect that you would get with Profhilo. So as to which one you would choose, it really depends on what it is that you're treating. I would say 90% of my patients would do the Profhilo, maybe 10% would do the Volite because they have a specific indication, which the Volite is better for. One thing that the Volite is really good for is, you know, when people have these very tiny small lines all throughout the lower face, it's really good for that, especially if you don't want to see any addition of bulk in that area. So if you're going to use Volbella, which sometimes I do, you will see a small amount of volume increase with that, but with the Volite, you don't see the volume increase. So after 6 months, if you feel like you want to do it again, then you just do another session of the Volite. And the more times that you do it, in my experience, the better the skin starts to look. Okay guys, so that's it for this week. I hope you enjoyed the video. If you've got any questions or comments about the Juvederm Volite, then let me know in the down section below. And I will see you here again next week, where I think we will be discussing another Juvederm. In the meantime, don't forget to like the video and subscribe to the channel. I'll see you later.